Hello everyone, my name is Ashish Rahi and today my topic is about the hospital acquired infection and its prevention. In this content, there is a hospital acquired infection. What is the hospital acquired infection? The sources, the route of spreads, antimicrobial resistance, control guidelines, and universal and standard precaution what we can take for hospital acquired infections. First, we will discuss about hospital acquired infection. In short term, we can say HAI. These are infection acquired during hospital care which are not present or incubating at admission. Occurring more than 48 hours after admission are usually considered nosocomial. Infection acquired in hospital by a patient who was admitted for a reason other than infection. An infection occurring in a patient in a hospital in whom the infection was not present or incubating at the time of admission. This includes infection acquired in the hospital but appearing after discharge and also occupational infections among the staff of the facilities. Patients with infection disease are frequently admitted into hospital. Some of these patients are able to spread their organisms to the patient, to other patient, and they provide once sources of infection in hospital patient admitted for other causes. When such patient require admission to hospital, the risk has to persist for other patients because it can spread the infection to other patient or near patients. Appropriate measures have to be taken to contain the infection with isolation procedures of varying degrees of strictness depending on the infections. The commonest form of HAI are due to invasive procedures carried out on patients such as surgical operations, intravenous therapy, intubation, catheterization. Immunodeficiency of varying degree is seen in many of the patients admitted to hospital. These include patient at the extreme of ages, patient with diabetes, receiving immunosuppressive drugs, or patient with cancer, in particular those undergoing chemotherapy and patient with diabetes. These patients are prone to infection with bacteria which have little threat for healthy person. There are 6 elements in the cycle of infection that are 6 must be present before the transmission of infection can take place. These are the ability to invade host, virulence degree, portal of entry, reservoir, portal of exit, mode of transmission, characteristics of the host. In the characteristics of the organism that is pathogen, what is the type, ability, virulence, ability, degree to which it causes disease, number of organism, and the portal of entry it may be eyes, mucous membrane, respiratory tract, placenta or place in host barrier, and in the reservoir it may be humans, maybe the host, animal, environmental sources, and the portal of exit, respiratory tract or genitourinary tract, placenta, blood, and mucosal surface. In the mode of transmission, it is direct contact, droplets, factors for airborne, and the characteristics of the host like that of the effective resistance, changes in the host defenses, tissue destruction. So these are the chain of infection 6 elements which can cause the hospital acquired infections, and it must be present before the transmission of infection can take place. So proper channel care take place should be provided to prevent from hospital acquired infections. So this is the hospital acquired infection and the 6 element of infections which I discussed with you about that. Thank you.